Our final speaker, or the person who's going to provide closing remarks, so this is the more informal part of it, is Vasanthi Srinivasan, the ADM who we relate most to. And I just want to take the opportunity at this point to comment on our relationships with the many facets of the ministry. I've personally had encounters in health in a number of different countries, 3 different countries, with ministries, departments of health, and particularly for the longest time in Australia. And I have found that the relationship here is the most enlightened that I've come across. And one of the things that strikes me is that here we have a ministry, and this relies on people. We call it a ministry, but it actually comes down to a few key individuals whose view is that research should take place, that it should be unbiased, it should be rigorous, it should be impartial, and it should inform policy. And the impartiality and the scientific credibility of that research is paramount. What that means is that in the last 5 years, when we have produced findings from time to time that are quite controversial, I have never felt under any pressure to change anything, a word in a paper, an abstract, a media release. There's always the opportunity to comment, their points are made, sometimes a deeper briefing is needed so the ministry can respond appropriately if the material becomes public. Sometimes there's a timing issue around an election, and that's quite appropriate. But otherwise, I think this has been an arm's length arrangement. I think personally it's quite remarkable. And I think it rests on the caliber of the people who we work with, who do not seek to control the evidence. Obviously, they have to control other things, but they don't control the results of the studies. And that's key to the work that we do. Without that, we would be unable to do our work. So there's a number of people involved, and he was here earlier. I'm not sure if Steny is still around, but Steny, before in his previous life as ADM, really, I think, embodied that very clearly. You have to do the research, tell us the truth. Is it right? That's what we need to know. But very much Vasanthi and Alison Paprisa, who's here as well, have followed that, well, not followed it, they've ploughed that very clear role, that clear path to maintaining the ministry's position of impartiality and arm's length as a funder of research and as a funder of ISIS. And I'm personally extraordinarily grateful for that, and obviously also for the importance they've given to funding ISIS, which has been critical during some, which is a testing time for all of us, including right now. So our work really couldn't take place without the support of individuals like Steny, like Vasanthi and Alison, and others. So I'd just like to pay personal tribute to them. And I have an opportunity now to invite Vasanthi to come up to the microphone and give some closing remarks to what I think has been a great day.
Thanks, David. Well, congratulations, and I bring all the best wishes to ISIS, all of you involved with ISIS, on behalf of Minister Matthews, who wish she could be here. You know how much she enjoys these conversations. And my deputy, Saad Rafi. So here we are, celebrating 20. Many, many more good years to come, because I think...
Oh, are there?
Well, since you brought alcohol up, David, we'll have to reconsider, but these are my notes. So, really, as we've started to reconfigure our research enterprise in the province, because something that David said, and I'm sure other speakers have alluded to during the day, we've begun to use research evidence in a most integrated, most fundamental and appropriate way. We actually have a research evidence tool that Alison and her people have put together that's not only used by our ministry, but actually has traveled in and permeated the public service. None of the cabinet submissions that we're bringing forward is done just with options that we think will fly. It's actually based on evidence that we draw from ICES data, from research that's done by researchers, often using ICES data and the administrative data sources that we have. So to say we do evidence-informed decision-making is not aspirational anymore in the province. It is happening. One of the examples we have, and maybe it's been alluded to, is the mental health addictions and mental health and addictions file. We're actually joining up databases, and you might think that this is not as impressive, but it's been hard work. Joining up health data with children and youth and education, soon to move into the justice databases. Look at how they can be connected, how they can speak to each other, so we can look at issues in a more holistic way as we move the strategy forward, I think is pioneering work. It's technically probably challenging enough, but tell me about the bureaucratic challenges. It's even more, because everybody protects, and it's got nothing to do with the Privacy Commissioner. I don't want to take her name in vain every time something doesn't go as well as we could. But many of you, most of you, may have seen the action plan that Minister Matthews put out January 2012. She's committed to reporting back to Ontarians next year. What it basically does is start to vision a system which is less dependent on acute and episodic interventions and really strengthen the capacity, the data, and the service delivery in the home and community care sector, keeping people in a place they want to be with the best care, the best quality care, and the most appropriate care. So that's happening in the Ontario scene. As far as the national scene is concerned, you'd be pleased to know health is #1 on the Premier's agenda. And this is not only because by far it's the biggest ticket item on all provincial budgets. 50, 53, in that range, each of the provinces, big and small, allocate their budgets. But really, the premiers have gotten together and tasked us to look at quality, patient-orientedness, access, and they've added to the agenda appropriateness. What should we be doing? Because we've been layering things on the system. So how do you do that disinvestment piece? Again, easier said than done. So this is not just coming from the health ministers. We had a meeting of health ministers, provincially, territorial, and with the federal minister last week in Halifax. Most of the issues that we talked about require the kind of data that we're fortunate to have through ICES, but also the cadre of scientists, yourselves, to do the analysis and in a timely manner bring us that analysis to inform us as decision makers or policy makers to actually put in the best policies and programs forward. So the premiers have gotten involved. We in Ontario are leading 3 things. One is clinical practice guidelines. It's not the development, as you all know. We've got reams and reams of guidelines developed. It's actually looking at the implementation and standardization across provinces. So through that effort, and there was a question about, well, we hear about Manitoba and Ontario, how wonderful. So how are we going to bring the other people into the sandbox? Hopefully that will be a vehicle. They've added appropriateness, as I mentioned earlier, so we need to scope that out. But by lead, what I mean is we need to make sure that we just don't go there and showcase the Ontario wonderful attributes as much as bring the other provinces and territories along. Try to put forward positions, put forward methods and models that everybody can see themselves, however large or small. It has to apply to Nunavut as it does to Ontario. That's the challenge. We've also been given the task of looking at drug shortages. We can't have another Sandoz situation occur. But our minister is most keen on looking at the generic drugs issues, how the approvals happen through Health Canada, and how can we do better. She particularly pushed for the delay and more thoughtful procedures for the generic version of OxyContin, because she believes very strongly that we need to spend time to do the research, to look at the various options before we go listing them, and where things start to get abused. So that's sort of percolating in that arena. The mental health addictions, as I mentioned earlier, big priority for the province. We've been looking at children and youth, but years 4, which will start in 14-15, will open it up to adults. So I can see us going to other ministries like social services. I know, David, you've already started conversations, but there are other databases that we need to join up. What I'm trying to say here is ISIS is not just for health anymore. It's looking at the whole spectrum of social determinants, which is how we would like to do health policy, which is the way we are doing health policy, and a way to actually stabilize, innovate, and make sure that we can, the cost curve and the bending the cost curve, all of that conversation is happening in many fora. There's legitimacy to all of that. But we're responsible for actually figuring out how. I think that's the more important thing, because the what has sort of been talked about. So without ISIS, we couldn't do that. So I wish you more than 20 years. We'll need you forever and ever. I'd like to thank 2 people whose idea and vision and expertise began this enterprise. Of course, Dr. David Naylor and Dr. Jack Williams, whom I just saw come up, because without such visionaries in the province, we wouldn't be where we are. Funding, as I see it, is a small part of it. That doesn't mean the funding will be small, don't worry. So what you've given us is that very specialized, rigorous, scientific, not always what we want to hear, but, and it's not advocacy, it's analysis, which has great credibility as we move it forward. Love the way we've expanded to other sites, because now it's no more a Toronto-centric institution. The spread from Ottawa all the way through to Western, wonderful downtown Toronto site and the one at Queen's, has increased access, so we can bring in more scientists and more information that's contextualized around those particular areas, because this, again, is a very big imperative for how we develop public policy. So I will end, because I was just asked to make concluding remarks, right?
And it's funding, I think, is happening.
And the funding. So what I'm here to sort of conclude with is that as we've seen ISIS as a foundation to the work we do, and more importantly, you scientists do, we've decided to hold the funding at a very stable base, and depending on how our conversations go, it could go up. But all to say that it's almost a guarantee to the research enterprise that if you make proposals, and many of you already have, for our research funding, you can be rest assured there's a data platform, and that's ISIS. So again, congratulations, all the best, and my team and I truly look forward to working with all of you, and wish us all good luck.
You can clearly see that even though she plays with my emotions, Vasanthi is a huge supporter of ISIS and has been for a long period. And it's tough when there are these fiscal constraints. The perception of balance and impartiality in funding is critical, and we understand that. And we do appreciate that the funding has been stable and remains stable during some very difficult times. It's been key. So my thanks to you, Vasanthi, to Alison, to Steny, before you for that support.